Hello and welcome to the American Journal of Healthcare Strategy. I am your host, Syed Siddiqi, and I'm joined here today by a great member in AI. I'm very lucky to be joined here. Do you mind introducing yourself for the audience?
Yeah, my name is Dr. Harvey Castro. I'm a ER board certified emergency physician, and basically, I call myself the nutty professor in that I do a lot of stuff, ranging from starting my own iPhone app company, having some vitamin company earlier in my career, to writing books during med school. And then when the first iPhone came out, had my first IV meds application, and I made about 30 apps in the App Store. To the most recent now is I did the first book called ChatGPT in Healthcare back in 2022. And so a little bit of a lot of stuff that I'm doing.
That's really, really cool. You recently published a book. Can you tell me a little bit about that?
Yeah. So, I take pride in being a thought leader and a futurist. And I wasn't going to buy the Apple Vision Pro. And I literally decided, you know what, 2 days in, I'm just going to head and get it. And when I put it on, my mind just blew up. I thought, holy cow, what if I use this in medicine outside of surgery? What if I did all these different things? And then the best part is I love AI. So I took AI, the Apple Vision Pro, put it together, and then obviously my healthcare and entrepreneur spirit, and put it all together and decided to write a book. And the crazy part is, within 10 days of the Apple Vision Pro coming out, I had this book out in the market talking about how to use it in healthcare.
Oh, wow. Yeah, that's a really fast turnaround. How were you able to, manage going from this whole the sensation of like figuring this thing out, deciding to join it with AI, and immediately coming out with a book?
I call it the pain point. We all have a pain point in healthcare. I'm really passionate about how can we use technology in healthcare, and I'm literally playing with it. And I tend to be a very creative person in that space. And so I literally put on my doctor hat, I put on my CEO hat. At one point, I forgot to mention, I created about 8 emergency rooms here in Texas and sold them. Had 350 employees, and so I know what it is to run a hospital, run an ER, have be in a C-suite in healthcare. And I thought, man, if I owned an ER and then I was working in the front line, what could I use? What would I like to do? So I literally put all these worlds together and started writing a book about different ideas. Nothing that cannot be done today. Honestly, some of the crazy ideas I came up with is just taking different technologies and putting them all into one. And I really think that is going to be the future.
What were some other ideas that you sort of showcased in your book?
Yeah, so we talk about different platforms. Obviously, the one that makes me most passionate as an ER doctor, and I actually saw Epic, the electronic medical record, showcase this, and I saw some slides. But the skinny is this: imagine putting in the Apple Vision Pro. Imagine you're my patient, and being able to have the information when seconds count. As an ER doctor, I may need your X-rays, I need some blood work, results, and so how nice if I had this thing on that I'd be able to see it and simultaneously take care of you. And so maybe you're unconscious or something's going on, and I need that X-ray. Being able to have that immediately in my vision and being able to see you and see maybe possible lacerations or trauma, and then see what your labs are in real time. And then the best part is, again, now this is being adding a little AI to it. Imagine you spoke another language and I couldn't really understand other than using a phone call and having to do this conversation. But what if I used the Apple Vision Pro, and as that input started coming to me, it's translating in real time and I'm able to hear it. And then as I'm speaking to you in English, it's translating and then giving it to you in your language. And so I thought, man, how amazing. Like this is something that would make a huge difference. And so it's all about having information and being able to use it. The other example, real quick, would be, again, using AI and the Vision Pro. A lot of times, a patient will come in and say, you know what, it's all in my medical record. And so when I start going through the medical record, it's just volumes and volumes of information. And in the interest of time, I ask the patient, can you tell me X, Y, Z? And they're like, no, it's in the record. Well, imagine having AI, having this, being able to speak to it, getting the record as I'm seeing you, and being able to look at it in real time. And you don't see it because it's all virtual, but I'm seeing the screen. And so these things in real time would be amazing. Now, obviously, there's, I don't know if you know this, but there's some neurosurgeons that already do neurosurgery with Apple Vision Pro. And then there's some general surgeons that are using it. And so there's already a lot of people using this technology, which is amazing in healthcare.
Mm. Do you feel as if this is something that could be done within the next few months? I know you mentioned some people are already using it. Do you think this can be something that could be spread to emergency medicine, to different specialties, or will this take, I guess, more time, like another year or two, or maybe even
Yeah,
longer?
no, excellent question. And unfortunately, the hospital system, there's always politics. And within the hospital system, those departments that are doing very well financially and bringing in a lots of profit, i.e., neurosurgeons, some specialties in surgery, they're able to tell the hospitals, hey, I want this toy or I want this new gadget. And they're able to have it in their funds because it is in their budget. Whereas some of the other parts of the hospital literally lose money. And so those departments are less likely to get some of this technology. With that said, I truly believe as we start creating use cases and to the point where we're showing that this is saving lives or becoming more efficient, the hospital system ultimately, I believe, in some departments will end up funding it when normally they wouldn't.
What made you interested in AI?
I got to give this story. I was coding a patient. I literally had just graduated residency. It was literally the iPhone 1 was out. And as I'm coding the patient, I gave the nurse an order to get a certain medication. And I was just amazed that she went and got a textbook out, started thumbing through it, found a page, verified the dose, got a calculator out. And I thought, oh my gosh, this is taking forever. And so, big picture, I thought, you know what? Let me teach myself how to program. Let me help and create an application that you just tap 3 times and it gives you the dose. And I literally did it. And I created the first IV meds app in the world and it went viral. And because of that moment, that explains it. Fast forward, I'm playing with ChatGPT. It's 2022, and I'm going through it thinking, oh my God, it was that iPhone moment that I had when I was making the apps. I thought, oh my God, this is going to change medicine. This simple tool is going to make just so many changes throughout healthcare. And I got so excited, I wrote a book on how to do this. And fast forward, I'm just fascinated because I'm thinking on so many levels we need to help people out there, but then finances or we don't have the tools. I thought, man, this technology, if used correctly, we're going to start giving access to people in a different ways of healthcare. We're going to improve our healthcare system by using these types of tools. And I thought, man, this is going to be the future. So, fast forward, we're in a couple of years later. I'm starting to see, big companies starting to integrate this into the workflows. I'm starting to hear different organizations saying they're spending money into AI to help improve patient care. So big picture, I'm really excited about AI in general. Obviously, it's something that I feel like it's just going to help humanity, and not just here in the United States. In fact, I do a talk on this, and I really think it's going to help people outside of the United States more than people in the United States because some countries, especially developing countries, they don't have healthcare. They don't have healthcare in certain parts of their country. And so I really think this technology is going to be used in certain ways that we won't use here in the States because we have physicians and there's a lot of lobbyist groups and whatnot. But I'm really just excited to see where we go from here.
With many big corporations and organizations sort of integrating AI into healthcare, do you feel there are any aspects that we as humanity should be careful of moving forward?
Yeah, that's a good question. Obviously I'm more worried of non-physicians and individuals outside of the United States, ironically, and let me explain why. Non-physicians don't know medicine by definition, right? And I'm more worried that they're going to use a chat GPT like they use Dr. Google, that they'll just put in their symptoms. And I'm worried that some patients may decide, this is too expensive to go to the doctor. I'm just going to ask ChatGPT what's wrong with me. And if ChatGPT says I'm okay, then I'm not going to the doctor. Fast forward, if I'm talking about patients that are outside of the United States, where you literally can go to a pharmacy and pick up whatever drug, then I'm really worried that they're going to self-diagnose. They're going to go to the pharmacy and pick up some medicine that may end up hurting them. And so I am worried about this being used the wrong way. And so right now I'm telling my patients, you know what, I'm fine with you using ChatGPT, but whatever it says, please run it by me. Please bring it to the office with questions, because I don't want ChatGPT to quote unquote hallucinate or give the wrong answer, and then that you go through that and it's the wrong answer. Even if the newer models are saying that they can get the error rate down to 4%, to me that's 4% too much, because this is life or death. These are situations with your health. And so in my mind, like that we got to be very careful. I actually last year, it's been about a year now, I wrote a book on ChatGPT and empowering patients. And I go through a whole algorithm explaining, okay, how can we use it in healthcare? But basically, it boils down to we need to make sure we're having the experts verifying that information, saying, yep, that is correct or not.
Do you feel as if there's any information where we can use AI or ChatGPT for that doesn't have to be run by a physician, can sort of save time in that front?
You see, that's a tough one, and it's a medical legal issue. And with healthcare, it's just really tough because I call it the bell curve. You know, you may be amazing at medicine and you may know a lot, but there might be someone that doesn't. And to give advice to two different individuals is still tough. You know, and with that said, there's medical students that can use ChatGPT and be fooled by ChatGPT because again, they don't have the full training. I think the sweet spot is going to be physicians in my mind that are somewhere 5 years plus out of residency, that they've been seeing patients, that they have the clinical gestalt to know that if AI is lying to them, saying things that are not right, that they could tell the difference. I'm on a mission to teach healthcare professionals around the world on how to use it, what to do, what it's doing right, what it's doing wrong, what are the things we need to worry. On the patient side, I really think we need to be advocates for our patients. We need to have signs in our clinics, in our hospitals saying, hey, here are the issues with ChatGPT or different AI. We need to warn them. With that said, I think if it's used right now, conjunction together with the doctor and the patient, we're going to have great outputs. I know that ChatGPT is doing away with plugins in the next couple of weeks, but I think this would be a great use. Example, say I have a diabetic patient and I know their hemoglobin A1C is the average of their sugar, say it's really high, and I know that it's probably their diet. Well, I can use ChatGPT, tell it, hey, give me a keto diet. This person hates fish, they don't like fruit, and then it'll customize. Then you're with me, and I can give you that output, and then I can take it down to a whole meal plan. But then the best part is with the plugins, I can plug it into your Instacart, and then by the time you go home, all the things that we talked about, they're in your house already ready for you. And I think that is the new way of using healthcare, using AI. I'm verifying it, making sure it is correct, and then I'm taking your data, putting it together, and then leveraging technology for us to give you a better outcome.
That's true. Yeah, that's very, very interesting. So I guess it sort of falls into the way we use AI rather than making everything all out there, you know? What
Yeah.
regulations do you think should be put in place so AI isn't misused in certain instances?
No, that's a good question. You know, as a capitalist, and I'm here in Texas, I'm obviously I'm hard against regulation. It's a catch-22. I want to see this progress. I want to make sure that it's going forward. To some degree, there's pseudo regulation in that. In healthcare, we have HIPAA, and in Europe, we have the GDPR, which is basically privacy rules. And there's all these laws that we have to stay confined to. With that said, if I had to pick some laws or regulation against it, obviously I want to make sure we protect our privacy with our patients and that we're not using ChatGPT to the point where OpenAI has all this information about my patients. But the good thing is HIPAA already covers that, so there's already regulations against that. Now, if I had to pick one, I actually would. I like the concept of creating what I call food labels. Let's create labels for AI, and whenever anyone uses any AI, a doctor, patient, they can pick up that particular AI and say, okay, here's the positive, here are the negatives, here's the training, and here's why we do not encourage XYZ because it's got bias in the data set, or this is how it should be used. That way, the average consumer can pick it up just like they buy, like I have some yogurt here with the food label. Well, grab my AI and it tells me these things. And I think that kind of regulation would be good because it's not slowing down innovation, it's not hurting us, but it's making us as a consumer more aware of what we're using.
I've heard many people talk about sort of the risks involved with AI and utilizing it. I know you mentioned earlier that it's a life or death situation, so 4% is 4% too many. Where do you think this fear sort of originates from? And should we focus on, I guess, whatever the cause is for this fear?
No, that's a great question. And yeah, I agree that we're afraid of the unknown. That's why I'm a big advocate of education. I created my own AI healthcare course. I'm literally going around the world giving lectures on this topic because we don't know. But here's the thing, if I can go into the C suite, if I go into the hospital systems and explain how this works, then they have a better understanding. Obviously, AI, we call it this big black box. We have no idea how this thing is getting output. We don't know the data. Like the average person has really no idea. And that's kind of scary. Like, how does it know? And then we have a distribution of physicians and healthcare professionals that vary in technology understanding. And so we have some people that really love technology and are early adopters and are bringing it into healthcare. And then we have some late adopters and some skeptics that are saying to the point, hey, if AI comes into my hospital, I'm just going to retire. And so we got to make sure that we're educating these individuals and explaining the good, the bad, the ugly, explaining to them how take the fear out. One thing that has been talked about is when there's an outcome that you put in a question, some output comes out of ChatGPT, why not create a knowledge graph? And so then the doctor can say, okay, I see how you got from point A to B to C to D. And these kind of models would be able to do it. The other thing is, ChatGPT was not meant for healthcare, but people are using it. We need models that are trained with medical information, that we're having physicians and healthcare professionals that are doing reinforced learning on these models to say, yeah, this is correct and this is wrong. And then when we have these outputs, we need to start focusing on certain verticals. For example, everybody's heard of radiology and how AI is helping it, but we need to start working on maybe diabetes and then really creating the right large language models for that particular problem, making sure that we're reinforced learning and that we're taking this to the next level. And so these are really key important things that we need to do as a society. And so as we move forward, we need to make sure that we're educating, we're teaching, and then if you out there are listening and you're getting better at this, then you turn around and teach others around you. And that's the only way that we're going to start really being able to understand this AI in healthcare and really taking it to the next level.
It's true. It's a domino effect. We're all helping each other. One final question. I know you have a long history of entrepreneurship. You were talking about your emergency medicine departments, which you created and sold. You created a few companies as well. You've written books. What advice do you have for those that are sort of interested in the entrepreneur side of healthcare? Is it sort of just finding a problem and a solution, thinking of a solution that goes with it, or is there more to it than that?
You know, I'm obviously I'm passionate about healthcare and AI, and I'm going to say that's the secret sauce. I think you need to find something that you're very passionate about. Obviously, it's a pain point. I'll give you two quick examples. I was in the emergency room working, and I'm going to say the principal called me into the office saying I was spending too much time with my patients. I was ordering too many tests. And I thought, okay, I'm a doctor to help. I'm not a doctor to make the hospital money. I'm here to help people. And so that pain point of not being able to give my all to patients really upset me. And so I took it to the next step. I literally got a group of investors. I literally started creating emergency rooms and I started doing a different culture, a culture that was the opposite. The more time you spend with patients, the better. The more praise and more you were doing for the patient, the more praise you were getting from the company. And so exactly that. I took a pain point, I took something that I was passionate about, and I did something about it. And I really think that's the secret sauce to entrepreneurship, having the passion, finding that pain point, and then really thinking outside the box. That's the third part. The things that I would do and the solutions I would come up with sometimes seem radical to others because it had never been done. But just because it wasn't done didn't mean it was wrong. It just meant I was doing it a different way. There's no reason to go from point A, B to C. I could go to A to D if I had to, if it was the right situation. And that's the part of AI. Healthcare professionals are fighting against some of the old ways of doing things. I know some people don't know this, but hospitals still use fax machines. And you're thinking, what? They're still using fax machines? Yes, a lot of hospitals are still using fax machines.
Yeah. I think it all comes down to progression and sort of adapting to the times and changing with it. And that's why your work in AI is very important. And I'm very fortunate to have this discussion with you. Thank you so much, Dr. Harvey Castro.
Thank you so much for your time. It was an honor to be here, and I look forward to coming back.
Of course. Take care.